Yes, my name's Katie. I am the Therapies manager for a charity called My Cancer, My Choices. Apologies if I'm repeating anything for those of you who heard, but I just thought I'd go through what we offer. The charity has been running 10 years now. It was set up by two friends. Mandy on the right had cancer herself. She was diagnosed, and she asked the NHS, was there any other complementary therapies she could support her treatment? And unfortunately, there wasn't anything. And when she went to her normal therapist, a massage therapist, they said, well, fortunately, we can't treat you. Now you've got cancer. So the charity was set up wanting to offer complementary therapy to everybody with cancer in the Berkshire area. So currently, over the 10 years, we've supported 2,000 people with cancer, delivering 7,500 treatments and courses. So we have a bank of volunteers who help us. And we also won the King's Award in 23. So the team went to Buckingham Palace, and that's for volunteering. So that's us looking after our volunteers. That was what the award was for. So just to try and explain what complementary therapy is, complementary is the aim is to treat the person as a whole. So obviously, when you go to your medical appointment, it's to treat the cancer more, where this is to treat you as a person and some of the side effects you're getting from some of the drugs or treatments you're having. It's not an alternative therapy. You might have heard that term. Complementary means it runs alongside your treatment. So we work very closely with the Royal Berkshire Hospital, with the cancer team there, to make sure we're aligned with what conventional treatment you're having, and we support that. So it's not alternative to what treatment you're already having. So 1 in 3 people with cancer do seek complementary therapy, and the cost can be £50 to £70 a session. And also, as I was explaining, it was more finding a therapist who's been trained specifically in treating people with cancer, and what that means, and what training they've had to understand, one, the side effects and how that can affect how you're feeling. But second, it was similar to what I was saying about this light touch therapy, light touch massage. So a massage oncology masseurs are trained in very light touch. So we give access to the therapist from diagnosis. And just to run through what we offer, acupuncture is one of our most popular, and acupressure is, if you've got a fear of needles, you can have acupressure, which is pressure points. Oncology massage, and I'm going to briefly go through what these are and how they can help you. Reflexology, scar tissue, so if you've had an operation and you've got a scar. Aromatherapy, Reiki, and then we do courses. So we do courses in mindfulness, yoga, Pilates, and art therapy. So we've got 4 locations across Berkshire. So our head office, where we're based, is in Charville, which is near Twyford. We've got 2 treatment rooms there, and we offer this is sort of the hub, and this is where we offer all our treatments. So all of them are covered here. And we are open Monday to Thursday. There's sessions in the morning and the afternoon. So they start at 10 and the last session is 3:30. So the Royal Berkshire Hospital in Bracknell, next to the chemotherapy ward, we've got a room there. And we offer acupuncture and oncology massage. And that's Monday, Tuesday, Wednesday, Thursday. We offer that. And then West Berkshire, Deanwood Golf Club, we have a therapy room there. And we offer oncology massage, reflexology and acupuncture. And then the College of Chinese Medicine in the centre of Reading, and that's purely acupuncture. So we have over 70 volunteers in total, but therapists, we have 30 therapists who volunteer across our 4 sites and run our courses. So a therapist might have their own business, their own sort of therapy rooms, whether it's reflexology, and then they give us maybe 3 hours a week, 3 hours every other week, where they come to our rooms and they give their 3 hours of time and they volunteer that. But in exchange, we offer them training. We offer them the social side because they get to join a really lovely team. And also it's the giving. So, sometimes you can't afford to give money, but it's a really nice way to give. So we've got a lot of sort of happy volunteers who sort of help us deliver the services. My job as therapies manager, I have to just double check that they've basically got the qualifications. So they're interviewed by myself and a trustee. We do their DBS, occupational health checks, qualification, check what professional bodies they're associated with, and their insurance. So once they've passed all that, they do mandatory NHS training in Cancer Pathway, and we do specific training on the different types of cancer, the different side effects, And it can be a two-way where they're then telling us how what they do for their therapy can help certain side effects. And then we look after them by doing their continual professional development and offer all sorts of different training courses. So I'm just going to briefly go through what we offer, and then you might decide from this what you think would be suitable for you. So acupuncture is the most popular at the moment, 60%, originated from Chinese medicine, but very westernized now. And it works with the nervous system to release natural painkillers such as endorphins. Now, I don't know whether you can see this image, but can you see how fine the needle is compared to a match? So it's 0.25 millimeters. I've had acupuncture and you almost don't feel the needles go in. Occasionally they hit a bit of something that just twinges, but you think, well, that's good. That hurt, that might be doing some good. So it isn't painful. It's just quite nice to lie in a bed actually and just have someone talk to you and, you know, speak to them about the side effects. And all our acupuncturists has to be registered with their local authority to practice, and we use sterilised needles, so it's all extremely safe. So what can it help you with? So pain, hot flushes is a good one. We get really good feedback from people who've had hot flushes. Peripheral neuropathy, I know a couple of you mentioned that. And again, there's really high evidence that a course of acupuncture can help. It helps with nausea, and the advantage is there's no side effects to the treatment. It's very safe. So that's acupuncture. Reflexology, this is all to do with your feet. So they use their fingers and thumbs to apply pressure, and each part of your foot links to part of your body, whether it's your nervous system, your bladder. So you would have a consultation at the beginning just to say, I'm not sleeping very well, or I'm getting hot flushes, or I've got indigestion, and they will tailor your session to try and target the specific problems you're having. So it's especially effective for relaxation, so general anxiety, digestion, it can help, and sleep. And we do, as an extra, offer reflexology lymph drainage, which can help with lymphedema, specifically after breast cancer. So I've had reflexology as well. It's a lovely one. And if you don't want to get undressed, you just have to take your socks and shoes off, lie on the bed. So it's quite non-invasive as well. Aromatherapy massage, you probably know a bit about this, but it's using beautiful oils. And again, they will ask you at the beginning of the session whether you want uplifting, whether you want calming. So we have about 20 different oils that are linked to different moods, and frankincense is very good for calming the nervous system. So again, our therapists are trained in how they can match oils to help you relax. Really lovely treatment. Again, just lying down on a bed in a lovely room, having a massage. So very good for stress and anxiety, any joint and muscular pain, because as we get anxious, as we get stressed, we tend to tense, and that's when we get all stressed in our shoulders. You've probably all experienced that. So it's a really lovely treatment if you just want to relax. Scar tissue is quite a specialist service we do. We have 3 scar tissue experts, and they're trained to work around any scars. It needs to be 8 weeks after an operation. But again, even after 1 or 2 treatments, the feedback we get is amazing. That the scar, it can restrict movement. It can obviously be sore. It can cause stress in the rest of your body. By learning how to massage it and use oils, and they will help you to learn how to do it for yourself. This is a really good one. It can reduce the visibility of the scar and also any sort of issues associated around it. So I'd highly recommend this if you have got an uncomfortable scar. So Reiki, we have 1 Reiki therapist. This can be hands-off or hands-on. So if you don't like being touched, this uses sort of energy to bring balance to your mind and body. So again, you'll have a consultation at the beginning, and it's just a very relaxing treatment. Lots of people fall to sleep. And again, you can be fully clothed. So if you don't want to get undressed, it's a good one. And then just to go on to our courses. So the courses are 8 weeks long for mindfulness. We do about 4 to 5 mindfulness courses a year. Some are online and some are face-to-face. Mindfulness is really good if you are suffering from anxiety, and particularly with a diagnosis, your mind jumps ahead 20 steps, and before you know it, you've catastrophized. So what mindfulness does is to try and help you to live in the moment, which sounds sound a difficult thing to do, but by using breathing techniques and some of the tools they give you in the sessions, just helps you to try and control your mind. So your mind is like a monkey that jumps about. And like we might, not recently, but go to the gym to exercise a muscle, the mental muscle needs exercising as well. And the more we can try and think positively, calm our breathing, focus on the now, we can try and train that monkey in our mind. So the courses obviously offer mindfulness, but it could be a great way to meet people who are going through similar as yourselves. And we find, particularly the face-to-face courses, that the people bond and will probably stay in touch after the course. So yoga is a course we do, and we're just starting an online one on Friday, but we've got face-to-face courses as well. And again, this is just focusing on balance, breathing. And again, it's not just the physical side of it, it's sort of calming your mind, and they teach you some breathing techniques to help. So we do face-to-face courses, and we do online as well. And then Pilates is a new one we've just started. Again, we've got a class starting in next month. And the teacher is trained specifically for people who have been through cancer. So it's a 6-week course, and this one, the one we're doing coming up, is a face-to-face one. Art therapy is a one-to-one. So you have a session with an art therapist. It's a 6-week course. And the idea is, if you find it difficult to talk about some things, by doing craft, art, talking about fabrics, you don't have to be good at art. It's a good way to try and to start talking about your feelings and what your cancer diagnosis, how that's affected your life. She is trained, again, to deal with people who are going through cancer. So these weekly sessions, it's on Zoom, so it's sort of, you just need to log on. And these can be really popular with people who maybe just don't want to talk face-to-face with someone. So just to go through the criteria, so the treatment is given to anyone with cancer up to 6 months post-treatment. The best thing to do if you're interested is to phone up and register, and they will take your information. 6 months is what we say, but if you're just over, or, we obviously consider what individual circumstances are. You get 6 complimentary treatments, so 6 free 1-hour sessions, and you can choose what you have. So you could have a couple of aromatherapy and then want to try reflexology, and then think I'll have Reiki. So the idea of the charity My Cancer, My Choice is, unlike sometimes you go through a medical and told what you need to do, you come to us and you can choose what you want, where you want it, time to suit you. The only difference, acupuncture, we recommend you have at least 4 in a row for it to be effective, because the evidence is that you need at least 4 for symptoms such as hot flushes and peripheral neuropathy. And you need to be living in Berkshire or being treated in Berkshire. So complementary therapies, these are the key things it can help with. So relaxation, reducing stress. Like I say, some specific side effects you might be dealing with, such as hot flushes, general mood improvement, and less pain. And it's something you can do for you, where you come and see. All our volunteers are so lovely. It's time for you to just be in the room with them, confide in them, where you maybe don't want to trouble your families. And it's just some time where you can sit, talk about you. And the feedback is always really positive that we get. These are some of the feedback. I won't read them out, but hopefully you can see the sort of feedback we get. And it's like the volunteer therapist said, it's a privilege for them to give up their time. And because we're doing something positive, everybody who comes through the charity is so grateful. It's just a lovely place to be. And the feedback we get is not always about the actual treatment, but it's just coming to somewhere where they can relax, just lie in a bed, have a blanket over them if they want, and just have a treatment that's tailored to them. So this is just to say how we support our service. So we rely on donations. So obviously all treatments are free, but if you can donate, that's great. We obviously rely on volunteers. So not just the therapist, but we have reception, admin volunteers, fundraisers. And just to go on to what fundraising we do. So we've got an active fundraising team and a fundraising manager. So we're always doing walks and runs and charity events to raise money, because it's all funded through volunteers. We have 4 paid roles in the charity, but the rest of people volunteer. So we do things like Frankie and Ruby, which is unwanted clothes. So we have a person anybody who wants to bring their old dresses, and she sells them on and gives the proceeds to the charity. And we also have quite a few businesses who support us as well. And then every year we have a big gala dinner. And in the September every year, we have a fashion show at John Lewis in Reading. And all our patients we choose 10 of our patients to come and model, and they're given clothes by John Lewis and have a makeover. And that's sort of a really, really positive event that we do. So that I don't want to go on too long, but I just hope that gives you an overview. And if you've got any questions, I can answer those now.